Hi, it's Erik Paulsen, and welcome to our video conversation this week. One highlight for me was listening to the President of Afghanistan, who came to visit Washington and speak to a joint meeting for both the House and Senate in Congress. I thought it was especially refreshing that he thanked the American people and its policymakers for the support that we've given to that country over the many years. And it was also refreshing to hear him talk about the need to crack down on corruption that is going on in the government of Afghanistan. Now we're going to get to our questions, though. First up is an email that comes in from William in Excelsior, and William writes in saying, "Dear Congressman Paulsen, as a constituent and as a provider of high-quality cardiovascular care and an active member of the American College of Cardiology, I urge you to vote this week to permanently repeal the flawed sustainable growth rate formula before the expiration of the current payment patch on March 31st. This legislation is a significant improvement over current law and represents a move away from volume-based care and towards quality and value-based care." Well, William, thanks for sharing your thoughts. And William's a doctor, obviously, and the issue that he is mentioning that comes up is something called the SGR formula, or more commonly known as the doc fix. And as typical Washington has been, every year we've had an expiration in policy where doctors are not getting reimbursed appropriately for the care they provide for their seniors. And every year we've had an expiration where if Congress doesn't address this patch or fix the short-term problem, our physicians see a 20% or more cut in their reimbursements. That's wrong, that's not right. Congress has done it 17 times, and the good news is a permanent solution finally passed in the House. First time in more than a decade, bipartisanly with a big vote. I strongly supported it, I strongly pushed for it. It makes sure, one, that our doctors will be redesigned in terms of how they get paid for quality of care and efficiency, and not Washington deciding that, but actually our physician community deciding those quality measures. Two, it also redesigns how other providers are going to be reimbursed for better coordinated care. And then third, it redesigns how seniors use Medicare, so there's more wellness and prevention programs that are a part of Medicare as well. Great opportunity to show bipartisan support on a real meaningful issue. Next up is a Facebook comment from Karen, who posted, "Congressman Paulsen, thank you. I believe people tend to go without the things they need and put their health at risk because they made it so difficult to use healthcare savings accounts or flexible spending account funds on over-the-counter medications. It has stopped me at times for my own over-the-counter medication needs." Well, Karen, thanks for those comments. What Karen is referring to is a provision in the new healthcare law that prevents anyone from using their own dollars in their healthcare savings account or their flexible spending account to purchase over-the-counter medication unless they get a doctor's prescription. That means Advil, Claritin for simple allergies. You have to go to the doctor to get a prescription to prove that you can use your own healthcare dollars for that purchase. That's wrong. It's not right. It should be reversed. And I introduced legislation just this week, along with the senator from Wyoming, to make sure that we're going to reverse that trend, to allow all over-the-counter medications to be purchased without a doctor's prescription, and also lift the cap so you can actually contribute more money to your healthcare savings account and flexible spending account in the first place, and use your own healthcare dollars as you see fit. Thanks for joining the conversation this week. If you have thoughts, ideas, questions, of course, reach me on Facebook or on Twitter or on the website at paulsen.house.gov.